Hello and welcome to Queer in IFS, a podcast by two internal family systems therapists, Alessio and Jude. I'm Alessio Rizzo. I'm an IFS therapist, a clinical consultant for IFS, I'm a trainer and a blogger. And with me we have Jude. Would you like to introduce yourself?
Thanks, Alessio. Hello, I'm Jude. I'm a Level 3 certified IFS therapist and approved clinical consultant and occasional trainer. And in this podcast, we explore themes and issues connected with gender, sexuality, and neurodiversity through queer and queering lenses.
Hello again, Jude.
Hey, Alessio. Good to see you.
Good to see you. Another juicy topic ahead of us. Some parts of me go, ooh, how are we going to make justice to this topic?
Right. It's a big one. And as we were just talking about before we hit record, we know in the scope of a 30-minute conversation that we are only really going to touch the edges of this. And at the same time, it felt like such an important conversation for us to have.
Yeah. And we're talking about decolonizing therapy. In particular, we're going to talk about IFS, but it's a much wider topic.
Yeah, the decolonizing field is huge. There's so much being written about and understood around the subject at the moment. And
shall we position ourselves to start?
Let's position ourselves. Let's introduce ourselves and position ourselves.
Why not?
Okay.
Why don't you go first? Why
don't I go first? I thought you might say that. Hello, I'm Jude, one of the co-hosts of this podcast, Queering IFS. I am white, middle class, British, and experience all the privileges that brings. I am also neurodivergent, queer, and I'm a psychotherapist, IFS certified psychotherapist, approved clinical consultant, and occasional trainer around all things neurodiversity, and big advocate as well for marginalized folks. Alessio.
Oh, it's me. I'm going to say all the things I want to say because I always forget something. So let's start with the easiest one. I identify as queer neurodivergent. And I am aware I rarely position myself from a kind of racial background piece because it's quite a confusing topic for me. I think the best one would be to call me Italian. So I'm an immigrant in the UK. And the color of my skin is a bit of a question mark. I'm considered olive-skinned in some areas of the world. I'm considered white in some other areas. I consider myself white and experience the privileges of that. Most places I go, especially in Italy, although I consider myself a white person from a colonized area of a white country, with all the complications that brings. And because we're talking about colonizing, I think it's relevant, this aspect of my identity to this talk. Professionally, I am deep into the IFS world, currently a trainer, an assistant trainer, and I think I can never pronounce, an approved clinical consultant. I'm just noticing all the colonization. Approved by who? I'm thinking. Certified again by who? Psychotherapist of IFS. And yeah. And I think I'm gathering the courage to talk about decolonizing. These are things that have been in my mind, on my mind for years, and I really want to kind of start by how do I find a way to do this, to give my gratitude and respect to some people that recently I have come in contact who have been an exemplar advocate for decolonizing IFS and the wider implications of therapy. And yeah, I owe them the current interest I'm having and the things I'm seeing in this aspect of therapy. So yeah, really grateful for those ones who voice it, talk about these topics. It's very inspiring to hear people talk about this.
Yeah, and I think there's an important point there that we are two white European therapists working within white Western models of therapy. And so we're not trying to speak for other colonized communities. We are trying to interrogate the ground that we are standing on.
Yeah.
Because it's so true that all therapy, all psychotherapy, all psychology, all what's the other one? Psychotherapy, psychology, psychiatry. The dominant paradigms in all of these were developed by white, middle class, Western men primarily.
Yes.
Often working on non-white bodies, which is a whole other thing. But all the roots of the work that we do, the roots of psychotherapy, and therefore the roots of IFS are in these white Western models.
Yes.
So that's what we're talking about when we're talking about decolonizing IFS, is opening up this conversation.
Almost decolonizing it from the inside out in a way, because we're in it. And it's therefore challenging to see the elements of colonization that already exist in it, because thanks to our privilege, we haven't really seen them or felt them.
Yeah. And thanks to privilege, we can also feel a bit uncomfortable and then move away.
True.
That's often the choice that people make, is to go, oh, yeah, that's uncomfortable. And then move away.
Yeah. And I'm thinking about Dick Schwartz. He names a few kind of aspects of what he calls cultural burdens. I think it's capitalism, patriarchism, and individualism. And then to them we can add ableism and many more. Racism. I mean, the list is endless almost. But because of how wide this topic is, I think, Jude, you had some ideas to how to kind of contain it. I think we said we'd keep it to IFS.
I mean, we know we can't do this topic justice, but we
exactly
in half an hour, but it felt important for both of us to speak about it. And I guess as you're talking about cultural burdens there, I was thinking, it's not just about when we're talking about decolonizing, it's what you were saying earlier, like certified by who, accredited by who. It's like we're questioning, whose knowledge counts, who gets pathologized,
Yes.
What is normal? What is neutral?
Yeah.
I mean, the intersections, of course, with everything else that we've talked about so far in Queering IFS are very clear, but it's kind of, colonialism is the taking of a worldview or a belief and literally colonizing the rest of the world with that, like forcing that onto countless ethnicities, cultures, pushing it out.
Yes.
And erasing what was there before.
Yeah. And it is a process that's happening to IFS as it spreads through the world. And as you know, I'm involved in, well, but maybe our listeners don't. I'm involved in IFS training programs, in countries where there was no IFS before, one of them being Italy. And we need to have English speaking trainers because there are no native people there. And I happen to speak Italian, although I had to learn the model in English. And then when we get to these new countries, the whole training is based on what's been done in other countries, in English-speaking countries. So what you're describing is happening to IFS these days, and it's important to hear the point of view of the people, the local cultures and communities who are receiving these.
Right. Yeah. And that's within Europe still. So then if we think about how what that means to cultures that are even further away from a kind of Eurocentric, white-centric kind of beliefs about them, even like that, that Western psychology isn't a universal truth.
It isn't, yeah. And no, this gives me the a way to get into one of the examples I was talking to you about earlier, Jude, and how Western and white this idea of confidentiality is. And I don't have the quotes ready with me, but during my studies, I read about the fact that if we go to non-white cultures and we tell them what we do in terms of you pay someone you pay for their secrecy, really. And they might just not see how this could be of any help. That you go, you speak to someone in secrecy. How does that heal? How does that heal? And it's the individualism. It might heal you. You have you time. It's protected. If the therapist says anything, there are huge repercussions on the therapist. But how does that heal the world?
Right. And it's what you were saying before we started recording around symptoms. We're treating the symptoms.
Yeah.
So in Western psychology and psychotherapy, we're treating the symptoms. We're treating you said it earlier.
Yeah, exactly. Go on. Yeah.
Yeah, we're treating the depression.
Yes.
Or the anxiety, or, I mean, whatever it is, but these are symptoms of this cultural framework which prioritizes individualism, is deeply hierarchical, and is nothing. There's no connection to what our minds or bodies evolved to do.
Yes.
And so of course.
Well, but it's an example of, it's a personal example I want to give. This was before I knew IFS. When I was doing my first training, I was still teaching in schools and doing training for psychotherapy. And at some point, I took like a middle management role in a school. And all of a sudden, they were piling up work on me just without even telling me. They forgot to invite me to meetings. They made decisions for me, and then they forgot to even tell me I had to do something. And then the day before a deadline, they told me I had to go through like 500 student records. That for a neurodivergent brain is absolutely impossible. And then I had to, I just stopped functioning. I had to be, I got off sick. I and when I came back, they restructured the whole thing. They basically got rid of my job and they hired someone else with the same job title. So there was this whole thing like, what? Sorry, you're hiring someone with my same job title and the same job description, but you're telling me that you need to restructure this? It's complete nonsense. But according to the system, it was me being somehow too weak, too sensitive, not tough enough, or not being up for this job. Whereas in my view, it was clear that this was an abuse of power, that this leadership just wasn't good at doing what they were doing. How could you give me work without asking my permission? And when this crushes me, you replace me with someone else. I mean,
yeah.
And the idea of them telling me, well, you've got to do therapy, I was like, for what? I mean, I could maybe ease my difficulty, but then will I ever been able to come back and tell you, look, you are causing this, and it's absolutely normal that I feel crushed when you do what you do in your position of power. It's not me that's the problem.
No, it's the extreme individualism. Like the distress is located in the person, the disease is in the person, the pathology is an individual. It's not a system. Because, what the Western mindset requires us not to see the structure that keeps people oppressed.
Yeah, exactly. So you go, maybe you speak in private to a therapist about all these things that are going on. But the bottom line, like what kind of therapy am I paying for? Is this therapy liberating me, or is this therapy making me a better worker bee? The one that accepts this kind of power abuse. I mean, I resigned, but God knows how many times these things happen all over the world.
Right. And how many people can't resign?
Exactly.
Because they have to make the money. It's I mean, capitalism and capitalism is so deeply intertwined, if not inseparable from what we're talking about. And so it's that sense of, like I was saying in the last podcast, therapy isn't neutral, and it can be a tool of the oppressor, or it can be liberatory. Well, I've said that like as a statement, but maybe it's more of a question. Yeah, it can it be? Can it be the tool of the oppressor? Can it be liberatory?
Well, I think there's two phases here. One is the phase of learning the tool, and you just do it because you need to learn the technique. And then this expansion of your professionalism to think, okay, what am I using this tool for? Am I enabling this narrative that if a worker is stressed is because the person is the problem, it's because they need to unburden more, they need to unblend more, or realizing that enough unblending and enough unburdening has happened. Now it is time to understand the level of exposure that's okay for that system to the structures that are creating the symptoms, because they're not going to go away.
Right. Yeah. So having an awareness as a therapist of well, doing your own work, doing your own decolonizing work as a therapist feels like it's about recognizing the value of the individual work, but also recognizing how you exist, how this work exists within power structures.
Yes.
And yeah, what are we doing? Are you shoring someone up? Are you helping them? Are you helping their symptoms reduce enough so that they can continue to participate in a world that's harming them? Or
Yeah.
and we're talking about things that are, you know, huge and beyond the power of one person to make a difference. We can't end capitalism. We can't stop colonialism. We can't. We don't have the power to do that. But there's something about how we meet our clients, knowing these are the waters in which we're all swimming.
Yeah, it becomes an ethical discussion to have with ourselves, our supervisors, and our clients as to, okay, what are we, you know, the distress, the pain that we're helping them with, where does it really come from?
Mm-hmm.
And, you know, go back to the sea of clarity of self. You know, we do a lot to work inside. We can realize how certain jobs or societal structures and events affect our system. We can then take off the extra edges. If there is trauma there, great, absolutely. It needs to be done. But then we need to be careful in a way to not continue to say, well, this is your burden.
Right.
And to say, well, now that you have done your piece, can you look outside with the clarity of self and see the invisible power structures that are causing harm? And your symptom is therefore coherent to a power structure that is harmful. And you can do as much as you want to yourself, but it will continue to exist because the symptom belongs to the whole system rather than to you as an individual.
Yeah. And I'm thinking about, I think it was, there's something about what you just said it and I've forgotten the word that you used, but there's something about the integrity of meeting an individual client, as we're talking about clients at the moment, with this kind of wider awareness, because therapy isn't neutral and therapists aren't neutral.
Exactly.
But also I'm just thinking about, you know, the cultural shape of IFS and the cultural shape of other therapies too. This isn't just about IFS. Every therapy does have this and how we, you know, we even things like self-energy and how we see that, or well, I mean, IFS itself. So IFS is what, 40 years old as an approach. And Dick Schwartz, the founder of IFS, he always says, you know, I didn't build it, I discovered it. You know, he doesn't take ownership of the concept of parts, but it's very clear, I think, well, I'll see if you agree, Alessio. It you know, this, it's kind of, it makes so much sense to so many people. You start talking parts and most clients can access that really easily. So this system, this internal system that we have of parts and self-energy must be ancient. It just must be. And I'm sure it's been interfaced and understood in many different ways over thousands of years, tens of thousands of years, hundreds of thousands of years. So it's also recognizing that there's a colonizing of the psyche through white Western psychology, psychiatry, psychotherapy. And IFS is a part of that.
Yeah. Yeah.
So when we're rigidly holding on to the IFS model, getting frustrated with clients' systems that don't comply, that's a point to notice, why is this bothering me? Why is this not working?
Yes.
And is that because actually we're expecting our clients to fit a box? Or perhaps we are ignoring the larger cultural context in which, cultural, social, economic context in which they're existing.
Beautiful questions. Yes.
And not necessarily ones we're going to answer.
But important questions to have, nevertheless. Because if we don't ponder on them, then the colonization that it is inevitably there will continue to be there undetected. And
right.
I agree with you, we cannot just all of a sudden change it. But we can start asking these questions and understanding how we are propagating colonialism. Because we are. There is no doubt about it.
IFS, it's not that long ago. Oh, I'm fired up, and we do need to finish in a minute, but it's not that long ago. It's within living memory that people who heard voices, people who had multiple personalities, were incarcerated, medicated, worse. One of the reasons that IFS has and so IFS, it was a very brave thing to bring out this model of multiplicity within Western medicine. But models of multiplicity of mind, of genders, of identities exist everywhere else in the world.
Exactly.
So we've erased something, and again, this isn't, like I think I said in the last podcast when we were talking about access fatigue, we're not saying these things to blame anyone in particular. We're opening up conversation. But you could argue, white Western medicine has erased Indigenous wisdom, erased Indigenous medicines, erased all of these things, and then comes up with a model of multiplicity from within. And that one is acceptable.
Right. True.
And I just think we need to be aware of that.
You're so right, because that concept would have been erased first and punished.
Erased, not okay.
Sanctioned.
Pathologized.
Medicated.
Lobotomized.
Oh my God.
Yeah.
Oh, we still have conversion therapy, remember?
Right. We still have conversion therapy. Yeah, we absolutely do. Yeah. So these things aren't over.
And we can start by talking about this, making a podcast episode and inviting people to think, reflect.
Yeah.
And get the conversation going.
Yeah. There's a brilliant book that I haven't referenced at any point today because we've been talking and I meant to and I forgot, but Dr. Jennifer Mullen's book, Decolonizing Therapy, is a good place to start with this stuff. And I will put that link in the show notes.
Please, thank you.
And there's probably lots of other good ones too.
Yeah, talking about links, I think we're going to add maybe something extra. I think if it's ready, we could put something to be part of a newsletter or distribution list so that people can keep up with our contents and projects.
Yeah. And in the meantime, if we don't do that in time, then we have our own websites where you are welcome to come and find out more about us. Absolutely. And Alessio is at therapywithalessio.com.
Yes, and you are anchored in self.
.co.uk. Sorry, I didn't know I was going to do that.
Oh, that's fine with me. Perfectly fine.
Yeah. Well, we really hope that this conversation today has been generative for you. And we know that there is so much we haven't included in this enormous and vitally important topic. But maybe if this is a jumping off point for you, fantastic. Yeah.
And if someone wants to visit us, be a guest on the show for this topic, I mean, contact us.
Yeah.
The websites.
Yeah.
One of them.
Absolutely. Yeah. Yeah.
All right then.
Okay. Thank you so much.
Thank you.
Bye for now.